Good afternoon to our webinar participants. Welcome to the first webinar and virtual workshop series for early career researchers entitled Introduction to Evidence-Informed Policymaking for Health. This webinar workshop is being hosted by the Department of Science and Technology, Philippine Council for Health Research and Development, in collaboration with the Ateneo de Manila University, Institute of Philippine Culture, eTURO project. So this webinar workshop will run for 3 days, and this will be the first day of this particular webinar workshop. We will be joined this afternoon by Dr. Harvy Joy Liwanag and a message from Dr. Jaime C. Montoya, and also from Ms. Ullyann Garcia, so a senior science specialist from Philippine Council for Health Research and Development. To introduce the context of this particular webinar series in the context of the UHC lecture series from Ateneo, I will be presenting a set of slides to orient you about this webinar. So good afternoon again to everyone. This is Dr. Dennis Batangan from the Ateneo de Manila University, Institute of Philippine Culture. Next. This particular webinar series under the eTURO Weekend project is part of a techno-governance program or approach for supporting transitions in the health system. As we all know, there has been transitions in the Philippine healthcare system because of the current pandemic that we have now, and also previously the universal healthcare law. What you see on the left of your screen are actually several of these projects, which I will explain a bit in this presentation. Next. So, the Institute of Philippine Culture is a research and training organization within the School of Social Sciences of the Loyola Schools in Ateneo de Manila University. It was founded in 1960 by Father Frank Lynch, and the IPC advances the university's mission and goals by generating knowledge that helps deepen the understanding of cultures and societies, improve the quality of life of disadvantaged groups, and build more peaceful and just equitable communities in the Philippines, Southeast Asia, and the rest of the world. What you see at the bottom of the screen are actually some of the activities and products of the institute. We have publications as exemplified by the book on Casa Boholana. We also have developed a massive open online course in partnership with the University of the Philippines and the Department of Health under an EU project. And we're now having a webinar entitled Introduction to Evidence-Informed Policymaking for Health, which is actually part of a series that I will briefly also explain later. Next, Sam. So the presentation will go through the background of the series, the context of this particular webinar series as within the National Unified Health Research Agenda, and as an integrating program for ICT and health research, a brief discussion on universal healthcare and the transitions that we're going through, and some brief information on the topics that we'll be handling in the upcoming series. Next, please. So what we started early part of this year is actually a series on universal healthcare, which was actually moving quite smoothly with the series of lectures. And then we had the pandemic, the COVID pandemic, of which initially it was still called 2019 nCoV. And then from there, as they say, the rest is history. We went through ECQ, GCQ, and we're still actually in the midst of that pandemic. Next slide. So the eTURO project continued on with the webinar series focusing on topics related to COVID, but within the context of health systems, no? And since February 13, 2020, up to now, we're still hosting this webinar series, of which we had around 1,423 participants per webinar. For this particular webinar, we actually have pre-registered 1,475 pre-registered participants. And thank you for participating and joining our webinars. Next, please. So the series on universal healthcare, which we started actually last year, had these particular topics. Now, we wanted to go back to social health insurance, the primary care benefits, health information systems, and then this year we started on the shifts, no, on the healthcare delivery system landscape. What you see in the photo at the lower right hand of the screen actually was the last webinar that we had at the Ateneo before the lockdown. No, we had former Secretary Manolet Dayrit and Vice President Walter Bacaresa of PhilHealth with Dr. Maricha Guevara discussing the topic, laying the groundwork for UHC implementation. Next, please. And as we went on with the series of webinars, we also hosted international discussions, no, the last two of which was on primary healthcare, universal healthcare, and a pandemic, of which we had resource persons, of course, from the Philippines and also from our colleagues outside the country. For the first one, we had Dr. Susan Rifkin from the University of Colorado and Johns Hopkins. For the second one, and Dr. Mary Roselis. For the second one, we had Dr. Soen Nun Chu, former WHO country rep, and Dr. Madeline Valera, also from the Philippines. Next. Going to the context, no, wherein these particular webinars have been developed, it's actually part of the PCHRD National Unified Health Research Agenda, which is actually a component of the Harmonized National Research and Development Agenda of the Department of Science and Technology. This particular webinar series, which uses ICT and health, no, or ICT, information communication and technologies, is part of the ICT and health priorities, no, of the Philippine Council for Health Research and Development, and of course, the Philippine National Health Research System. Next, please. And from that particular research agenda, we developed within the Institute a series of projects we call technology-enabled or techno-governance projects, focusing on what we have framed, no, as creating digital spaces for citizens' health access. And this includes the eHealth project or eHealth PH project, the eHatid LGU project, and the eTURO project, which is actually hosting this particular webinar series. Next. And part of the inputs of this ICT and health for NURA is actually looking at the support it can provide to universal healthcare. No, as we know, universal healthcare law was passed last year, and a significant part of the universal healthcare is the eHealth component, which is actually part of the governance, no, health governance component of universal healthcare. And eHealth, in this particular case, includes e-learning, of which the webinar series is a project that supports the e-learning component of the universal healthcare. Next, please. Just to briefly show one of the main elements, no, of the universal healthcare, which is the healthcare provider network, and to highlight the fact, no, that the service delivery and capacity building components will have a very strong e-health component, no, as designed, no, and as will be implemented. What I've included in the screen actually on the upper right left-hand part is the override, no, which the COVID pandemic has actually done to the evolution of our healthcare system. So we're still actually in the preparatory phase, no, for this universal healthcare, with particular focus on the healthcare provider network. And you can see how complicated the evolving system is with regards to the healthcare provider network. It became more complicated with the pandemic sort of overriding some of the preparations and some of the mechanisms that are already in place, with regards to our healthcare provider network and the service delivery network. Next, please, Sam. And that's where we actually tried to locate these inputs on e-learning, including this webinar series. Anchoring this on the policies, e-health policies and guidelines for the health system. For now, the main policy document will be universal health care, and the related with the goal or an aim of improving health services and using e-health platforms like this one on the webinar series to help our health workers in the adoption of policies and technical solutions to address the identified gaps. Next, please. So finally, next slide, please. Just to sort of invite you to the series that we'll be having for this July and August, which includes this first DOST-PCHRD virtual webinar and virtual workshop for early researchers, which is actually a first of its kind, and hopefully we'll be able to have another one of this type of online webinar and virtual workshop. And we will have a series of webinars this week on nutrition, followed by a webinar on economic issues at the LGU level. And then later this month, we will have co-hosted webinars with regional partners, specifically Region 2, and later with BARM, or Bangsa-Moro Autonomous Region of Muslim Mindanao. We also have a series running with the Department of Health Calabarzon every Thursday, which started last week. So the posters that you see at the bottom of the screen actually are the current webinars that we're having this week. And we hope you will join us in these webinars. Next slide. So with that, we'd like to thank the Department of Science and Technology from the team, from the Institute of Philippine Culture, including myself and Mr. Dalupang, Ms. Patra Garcia, Ms. Beatriz Beato, Ms. Justin Calderon, Mr. Barry Codera, and also for the CHD Calabarzon team, Haraya and Queen, who has been helping us in putting up these webinars. So we hope that with this particular introduction, you are able to understand and appreciate how this particular series with DOST and PCHRD on Introduction to Evidence-Informed Policymaking for Health workshop and virtual webinar fits into the series, the UHC series, and the research agenda that we're working with PCHRD on NURA, or National Unified Health Research Agenda. Good afternoon, everyone. And at this point, I'd like to introduce the welcome remarks to be given by Dr. Jaime Montoya, and will be represented by Ms. Ullyann Garcia. So briefly introducing Dr. Montoya. Dr. Montoya is a highly trained infectious disease specialist with a Master's of Science and Diploma in Clinical Tropical Medicine from the London School and Tropical Hygiene at the University of London in UK, and certified by the Royal College of Physicians of Microbiology and Infectious Diseases. He also has a Master's of Science in Bioethics from the University of the Philippines College of Medicine. He also recently earned his PhD in medicine from the Hontendo University School of Medicine in Tokyo in Japan, and has a current appointment as Professor 8 at the University of the Philippines, College of Medicine in UP Manila, and currently also the Executive Director of the Philippine Council for Health Research and Development, Department of Science and Technology. Currently, he also is the President of the Philippine Association for the Advancement of Science and Technology. So to represent Dr. Montoya, I'd like to call Ms. Ullyann Garcia, Senior Science Research Specialist from the Philippine Council for Health Research and Development, Department of Science and Technology. Yuli, over to you.
Thank you, Dr. Batangan. So good afternoon, everyone. Dr. Montoya sends his apologies for not being able to deliver this message himself. He has to attend to an equally urgent meeting this afternoon. So allow me to read his opening remarks. To our speaker and facilitator, DOST Balik Scientist, Dr. Harvy Joy Liwanag, our partners from the Ateneo de Manila University, Institute of Philippine Culture, led by Dr. Dennis Batangan, webinar participants, ladies and gentlemen, good afternoon. It is my pleasure to welcome you all to the first DOST Philippine Council for Health Research and Development webinar and virtual workshop for early career researchers, an introduction to evidence-informed policymaking for health. This is an important platform as we address the need to translate our research results into policies and actions, taking research from bench to bedside. Capacity for research translation requires researchers to be knowledgeable of the basic policy-making process and to develop the skill of converting research findings into policy instruments that policymakers can easily understand to help increase evidence uptake. We are fortunate to have resource persons in this webinar series whose breadth and depth of experience in the field of health policy and public governance will help us walk through the whole process of research to policy translation. We have DOST Balik Scientist Dr. Harvy Joy Liwanag to share his insights on evidence-informed policymaking for health and discuss what makes research translation effective in influencing national policies. In the coming days, we will be joined by adjunct professor of the Ateneo School of Medicine and Public Health and former Department of Health Secretary, Dr. Manuel Dairit. We also have the Director of DOH Health Promotion and Communication Service, Dr. Beverly Ho, and also the Director of Organic Intelligence Health, Dr. Jason Ligot, to further expand our knowledge on several topics such as evidence-informed policymaking in the time of COVID-19, communicating research effectively for policy development, and perspectives on evidence-informed policymaking for health. Health research plays an integral role for strengthening health systems and ultimately achieving equity in global health. But the most important benefit of health research lies in its utilization, translated into strategies, technologies, policies, and interventions that will make lives better for the Filipinos. I wish everyone a productive 3 days of webinar. Let us take this time to learn and understand research to policy processes. I highly encourage everyone to participate and take advantage of the open forum to learn and gain insights relevant to research translation. Magandang hapon at mabuhay tayong lahat.
Thank you very much. Thank you very much, Ms. Yuli Garcia, for that message from Dr. Jimmy Montoya. At this point, I would like to introduce our main resource speaker and main organizer, actually, of this particular event. I have the opportunity to work with Dr. Harvy Liwanag when he was still with the Ateneo School of Medicine and Public Health, fresh from med school then. Now he is a he's a medical doctor, as you know, and a health systems specialist. Dr. Liwanag, through the Balik Scientist program of the Department of Science and Technology, returned to the Philippines in 2019 and joined the Department of Health through the Health Human Resource Development Bureau, where he provides technical assistance in strengthening the health workforce as a critical component of the health system. Dr. Liwanag has a number of publications that analyze health system governance and decentralization, as well as soil-transmitted helminthiasis in reputable journals, such as those published in PLOS and BMC. He has a strong interest in research topics relevant to accelerating universal healthcare and health systems strengthening in low and middle income countries. For the current pandemic, he is assisting the Department of Health in order to address the rise in forecasting the number of very important the health workforce required for the Philippines in order to address the rising cases of COVID-19. Between 2015 and 2019, he was with the Swiss Tropical and Public Health Institute in Basel, Switzerland, for his PhD in epidemiology, which was funded by the Swiss government. He was formerly a researcher of the University of the Philippines, Manila, National Institutes of Health, between 2012 to 2014, and obtained his MD, dual degree, MD and MBA degrees, as a member of the pioneering batch of graduates of the Ateneo de Manila School of Medicine and Public Health in 2012. So without much further ado, I'd like to give the floor now to Dr. Harvy Liwanag for his first lecture for this afternoon for this webinar workshop on Introduction to Evidence-Informed Policymaking for Health. Over to you, Harvy.
Thank you very much, Dr. Dennis Batangan. Am I being heard loud and clear? So, okay.
Yes, Harvy, we hear you. Yeah.
Thank you. Magandang hapon po sa inyong lahat. Before I left for Switzerland in 2015, I was then teaching in the Ateneo School of Medicine and Public Health. And I had the pleasure of having Dr. Batangan come over to teach in the school. In fact, just 4 months ago, before NCR went into lockdown, I was also with Dr. Batangan for a curriculum workshop. So our collaboration goes a long way back. And I would like to express my sincerest gratitude to Dr. Batangan and the entire eTURO team of the Ateneo de Manila University Institute of Philippine Culture for this current collaboration that has made it possible for this first DOST-PCHRD webinar / virtual workshop on evidence-informed policymaking for health, which is now part of the eTURO weekend series. After all, the concept of universal in universal healthcare, which actually means that no one is to be left behind. It's not only about equitable access to health services, but also about equitable access to information and capacity building. So I believe the restrictions we currently have because of COVID-19 can be seen rather as an opportunity to accelerate distance learning and virtual knowledge sharing that reaches even the farthest parts of our country in the context of advancing equitable access to information and capacity building as part of UHC. So this webinar and virtual workshop in collaboration with Ateneo de Manila's eTURO is a contribution to this effort. So allow me to express also my deepest thanks to Dr. Montoya, Executive Director of PCHRD, for his message for us today. Dr. Montoya played a significant role in facilitating my homecoming to the Philippines last year under the DOST Balik Scientist program. And he was instrumental in making my placement in the Department of Health Human Resource Development Bureau under ASEC Kenneth Ronquillo possible. So thank you to Dr. Montoya and PCHRD for initiating this idea to have the first DOST PCHRD webinar virtual workshop on evidence-informed policymaking for health, and for this distinct opportunity to work with your research to policy translation unit to make this a reality. So we're calling this as the first webinar or virtual workshop because way back in February, the Research to Policy Translation Unit of PCHRD and I were really planning to develop a face-to-face workshop on evidence-informed policymaking, especially designed for early career researchers. It was in fact a capacity building request to PCHRD by our regional research consortia under the Philippine National Health Research System, or PNHRS. For the first batch of this workshop, we were looking at a small group of about 30 participants from across the country. And the plan was to convene in some faraway resort for 3 days or so to exchange ideas on evidence-informed policymaking for health. And then we'll have some senior mentors to come over and advise the group. Unfortunately, COVID-19 happened. But then again, as I said, we had to look at the situation more as an opportunity. And so given the possibilities offered by technology, we have shortened the module and simplified the objectives of the workshop, but transformed it into a virtual workshop / webinar where we will still have a pre-selected group of 31 researchers doing the workshop. But likewise, we decided to open the proceedings of the event as a webinar offered to the public. So we are fortunate to have an excellent, can we go back to the previous slide, please? We are fortunate to have an excellent lineup of collaborators for this virtual workshop webinar. Dr. Batangan will be our moderator for today and on Wednesday. On Friday, we will be joined by former Secretary of Health, Dr. Manuel De Rit, and the new Director of the Health Promotion and Communication Service, Dr. Beverly Ho. And then on Wednesday, we will be joined by Dr. Jason Ligot, Director of Organic Intelligence. Next. I'd like you to meet the excellent team from PCHRD who acted as the organizing committee for this event. So as part of PCHRD's Research Information, Communication, and Utilization Division under Ma'am Merle Opeña, the Research to Policy Translation Unit is headed by Ms. Ullyann Garcia, who spoke earlier, and she is assisted by these very young and efficient science research specialists, namely Fatima Espiritu, Faye Lagrimas, and Samuel Piamonte. Today is possible largely because of their excellent work, so I'd like to thank them at this point. Next slide, please. I'm supposed to give an overview of the virtual workshop or webinar. Let me give the background. So we know that the Philippines is aiming to accelerate universal health care. But we also know that achieving UHC relies on health policies and programs that will be effective in achieving the targets that we have set for the health sector. However, effectiveness of policies and programs in the health sector, whether in the Philippines or elsewhere, relies on the extent to which these are able to draw from the best research evidence available. How then do we translate our researches into effective health policies and programs, not only to achieve UHC, but also to ensure that the Philippines becomes one of the healthiest populations in Asia? It may sound simple, but research translation into health policies and programs is actually not a straightforward, but rather a complex process. Next. Our goal for this virtual workshop / webinar is simple. So we just want this to introduce early career researchers to the process of evidence-informed policymaking for health, its basic concepts, how they may be able to apply these concepts to translate their own researches into policy and practice. Next. Specifically, our objectives are in the domain of knowledge for the participants to become familiar with the research translation process as part of evidence-informed policymaking for health. in the domain of skills, particularly for our 31 virtual workshop participants, to disseminate the research findings through policy briefs and effective communication. And finally, in the domain of attitude for both our virtual workshop participants and webinar participants to appreciate the importance of research translation as an essential component of the research cycle. Next. So as already stated, we have two groups of participants joining us today. We have pre-selected 31 virtual workshop participants who are joining us today and who will be doing additional work in between our webinar days. So that's Tuesday and Thursday. We have opened the proceedings to the public as a webinar who comprise, and the webinar participants comprised most of you today. Next. I'd like to introduce the 31 virtual workshop participants who have been nominated by the various regional research consortia as part of the Philippine National Health Research System. They come from various regions of the Philippines, and their names and institutions and regions are seen on the screen. And this is the next screen for the other participants. As you can see, many come from academic institutions, but we also have participants from research institutes and hospitals. Next slide. Now let me say something about most of you, our webinar participants. As of yesterday, we had 1,525 individuals who registered for the webinar and hopefully are actually joining us today as I speak. So majority of those who registered are females, almost 70%. Many are indeed early career researchers, with almost half of you indicating that you have 3 years or less of experience in health research. Almost half of you also come from academic institutions, but we are also very happy to see that we have participants from national government agencies. I think many of them from the Department of Health, particularly the Health Human Resource and Development Bureau, who are joining us today. And we also have participants from GOCCs, R&D institutions, healthcare facilities, NGOs, and the private sector. Next. 3/4 of you are based in Luzon. However, we do note and are very happy to see that even if majority are based in NCR, we do have representation from all regions of the country, including BARM, and in fact even participants from abroad. So wherever you are joining us from at this very moment, let me thank you already for taking the time to listen to us. We wish that all of you remain safe and healthy during this time. And I'd like to confirm at this point, if those of you who registered are actually joining now as we speak. So next slide. We will now do a poll. Okay. So please tell us from where you are actually watching us today. Kindly look for the poll icon. I believe it's under the chat function at the right side of the screen. Hover over it and please vote. Tell us where you are at this very moment. I will give you 30 seconds to vote. So timer starts now. So please vote. All right, I think, okay, it's time to end the poll. We are now closing the poll. Can I ask our team to please flash the results? Okay, this is our results. So 40% from NCR, but we also have we're very happy to see participants coming from, I think we have from all regions essentially. We'd like to give a special shout out to those who are joining us from Central Visayas. We pray that your situation there will resolve very soon. Okay. All right. So even 1% from abroad. So thank you for voting. Next slide. So this is our schedule for today. Immediately after this overview, I shall proceed with the introductory lecture. And that will be followed by a presentation from Ms. Ullyann Garcia to give us some updates on developments from PCHRD in the area of research translation. This will then be followed by another but shorter lecture from me. And then we will end with some instructions for you. You will have an opportunity to ask your questions during the open forum. And we aim to end around 4:45 today. Next. This is the schedule for Wednesday, and we will start again at 2 p.m. What is not shown here is that tomorrow we will have small group discussions with the virtual workshop participants, but that will not be open to the public. So you notice how we are doing this, no? We are convening with plenary webinars, and then we do workshop activities for a smaller group in between. So this might be an interesting model for a hybrid virtual learning experience in the time of COVID-19. So on Wednesday, Dr. Jason Ligot will join us to talk about communicating research and how to do policy briefs. Next. This is the schedule for Friday, where Dr. Manuel Derrick will join us to share his perspectives on evidence-informed policymaking. And then that will be followed by the group presentations to our panel of experts by our virtual workshop participants. So our virtual workshop participants will be doing additional work. They will be presenting their group research projects on Friday. And we will hear reactions from our panel of experts regarding how effective they were in convincing our policymakers to use the research findings and translate them into policies. Next. Now, some house rules. During the webinar, if you encounter connection problems, please click the reconnect button. Participants are in listen-only mode. You may ask questions or comment through the chat box on the lower right corner of the screen. Please make sure to type in your name and institution with your questions and comments. Polls will be conducted from time to time. To answer a poll, hover over the poll icon to select your response. During the open forum, the moderator will read and direct the questions to the resource persons. And we always value respect and courtesy during the entire webinar. This webinar is being recorded. Next. After the webinar, the organizer will send webinar codes at the end of each day and a link to the webinar evaluation form on the last day, which is on Friday, via email. Certificates, announcements on webinar replay, and webinar presentation links will be automatically sent to your emails at least 72 hours or 3 working days after filling out the evaluation forms. Please double-check your email address during your registration, and when answering the evaluation, you may not receive your certificates if your email address is incorrect. And kindly check your spam folder as well, because sometimes the emails are sent there. Next. Now, certificate of attendance will be given if all 3 days are attended, and if the attendee answers the evaluation form, which is emailed after the last activity on Friday. However, for our virtual workshop participants, since they will be doing additional work, they will be receiving certificates of participation. Please note that attendance to webinar replays does not qualify for issuance of certificates. Next. Now, if you have any administrative questions, may I please request you to get in touch with our PCHRD Research to Policy Translation Unit, whose email addresses are flashed on your screen. Next slide. All right, this is the part for the opening lecture, but before I continue, may I request for a 1-minute break? So we'll just go on a 1-minute break.
Thank you very much, Dr. Harvy Liwanag. So please stay on. We'll just have a 1-minute break in transition in preparation for the opening lecture that will also be provided, will be given also by Dr. Harvy Liwanag. So please stay on and wait for the resumption, no, of the opening lecture from Dr. Harvy Liwanag.
All right, I'm back. So if you guys are ready, I think we can start the opening lecture. Next slide, please. So good afternoon again, ladies and gentlemen, mga minamahal naming kababayan. The title of this presentation is, What is Evidence-Informed Policymaking for Health? And on this slide, I have the logos, both of the Department of Health, which is my host organization, and the Department of Science and Technology, which manages the Balik Scientist program. Next. Well, I did my PhD studies in epidemiology and public health in Switzerland at the Swiss Tropical and Public Health Institute in Basel. I thought I should show this slide first, just to reiterate how far Switzerland is from the Philippines and how small a country Switzerland actually is when compared to the Philippines. And many of you who watch Korean dramas, particularly Crash Landing on You, earlier this year, I'm sure you were impressed with the many beautiful scenes from Switzerland. One of those scenes was the picturesque Lake Brienz. You remember the piano scene, the very nice piano scene. So this was the lake where that scene was shot, and I had the chance to be there in the exact same lake sometime last year, even before the cast shot their scenes there. Why is this related to the topic? Well, I'll get back to it later. Next slide. What are my objectives for this presentation? Well, the main goal is for us to gain a conceptual understanding of evidence-informed policymaking for health. Next. Our specific objectives for you is that you would be able to describe the process of research translation into policy and vice versa. Identify some of the issues that affect evidence-informed policymaking for health, and hopefully be able to apply these concepts to enhance the relevance and effectiveness of your respective works, either as researchers or as policymakers and program implementers. Next. Of course, we have to talk about the current pandemic. This is a slide I borrowed from the DOH Epidemiology Bureau. The data is as of July 10. Our number of COVID-19 cases has reached 50,000, majority of which come from NCR, followed by Central Visayas. On the positive side, we have seen our case fatality rate go down to 2.6%, in contrast to the current global average of 4.4%. Our number of recoveries has long surpassed our number of deaths, and more than 90% of our active cases now are actually mild. Next slide. Although we still do not have a vaccine against SARS-CoV-2, the virus that causes COVID-19, by now we do have options for treatment that have been shown to be effective. Remdesivir is one of them. It's a broad-spectrum antiviral. There was a double-blind randomized placebo-controlled trial of intravenous remdesivir involving more than 1,000 hospitalized adult COVID patients. And the results of the study was published in the New England Journal of Medicine last May. And the results indicate that with remdesivir, hospitalized adult COVID patients, particularly those with evidence of lower respiratory tract infection, recovered faster than those patients in the placebo group. So next. And you also probably heard about the study on dexamethasone, a corticosteroid that is quite common and something that we have been using to treat many inflammatory conditions. Well, in another randomized controlled trial involving more than 2,000 patients, which has been pre-published in medRxiv because of the significance of their findings, it was shown that dexamethasone reduced mortality by as much as 30%, but particularly among those COVID patients receiving mechanical ventilation, and as much as 20% reduction in mortality for those patients receiving oxygen support without mechanical ventilation. So please note that in both remdesivir and dexamethasone, there's a very specific group of COVID-19 patients where effectiveness of treatment has been shown. And we should always interpret the results of these studies in this light. Next. And you also probably heard about our famous anti-malarial drug, hydroxychloroquine. It still is primarily an anti-malaria drug. There remains no strong evidence from studies showing that hydroxychloroquine is effective for treating COVID-19. There was a study that analyzed patient registry data published in the prestigious Lancet last May, saying hydroxychloroquine had no benefit, but in fact increased the risk for ventricular arrhythmias among COVID patients. Unfortunately, because of serious concerns regarding data analysis, that paper was retracted by the Lancet last June 4. And then the next day, June 5, there was an official statement from another group, the Recovery Trial Group, which performed an actual clinical trial of hydroxychloroquine involving more than 1,500 patients. And the results reaffirmed that hydroxychloroquine has no benefit in either reducing the duration of hospitalization or reducing mortality and other outcomes. Next. And so we now live in a day and age when research evidence matters significantly when choosing the best treatment for a certain condition. We've come a long way from, say, the 1970s, when expert opinion or experience alone mattered. At that time, medical practitioners chose solely based on what they've learned from their experience. And that was the concern of Archie Cochrane. You probably know Archie Cochrane, after whom the Cochrane reviews are named. So reflecting on the UK NHS in 1973, he said, "I had a considerable clinical choice of therapy. My trouble was that I did not know which to use and when." Next. That has led us to where we are now. We now live in the age of evidence-based medicine. What is it? Let's draw from what the father of evidence-based medicine himself, David Sackett, wrote in the British Medical Journal in 1996. He said, "Evidence-based medicine is a systematic approach to clinical problem solving by the integration of best research evidence with clinical expertise and patients' values." Next. And so, in evidence-based medicine, while clinical expertise still mattered, that has to be integrated with what the best research evidence available out there actually says, and further integrated with what your patient values or prefers. EBM says if we want to achieve the best possible clinical outcomes for our patients, we need to draw our decision from the intersection of those three dimensions, as shown in this figure. Next. This is essentially true when treating sick individuals. We diagnose the disease, we understand the pathophysiology, we apply the principles of evidence-based medicine, we treat the sick patient, and hopefully the sick patient recovers. Next. It's a totally different situation when we are trying to treat a sick health system. Here, we are not only treating an individual, but an entire community, or a population, or society, if you wish to call it that way. For example, it's quite challenging to improve a hospital situation such as this. It's not just a matter of giving a dose of something, and the health system gets healthier. Next. As a segue, perhaps let me just say something about my alma mater. I belong to the first batch of graduates of the Ateneo School of Medicine, and, emphasis on and public health. The mission of the school is to produce the physician leader who is able to treat sick individuals and also able to help treat our health system. A doctor who is an outstanding clinician, a dynamic manager, and a social catalyst. Next. And so we know that patients can be very complex because the human body is very complex. Next. And yet, health systems are even more complex, where there are multiple components interacting with one another in ways that sometimes we cannot even control. Sometimes we can control them, sometimes we cannot. Next. So let's have some definitions at this point. One of the earliest definitions of evidence-based public health was the one proposed by Jenny Seck in the Journal of Epidemiology in 1997. What did he say? Evidence-based public health is the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of communities and populations in the domain of health protection, disease prevention, health maintenance, and improvement. A more recent definition would be from Kohatsu in the American Journal of PrevMed 2004, Kohatsu et al. They said, evidence-based public health is the process of integrating science-based interventions with community preferences to improve the health of populations. Does that sound familiar? Does it sound familiar? The word integration, integrating science-based interventions with community preferences to improve the health of populations. We'll see that later. So next slide. Let's have more definitions now. What about research translation? And I will draw from this paper by Searles and others in 2016. They said, research translation is a process of knowledge generation and transfer that enables those utilizing the developed knowledge to apply it. This definition acknowledges that once generated, knowledge flows can be multi-directional and non-sequential. And so research translation does not have to be going towards one direction only. It should spread to directions where it will have an impact in policy development or program implementation. Next. What about research impact? Also from the same paper by Searles et al. Research impact, the demonstrable effect from the flows of knowledge between basic, patient, and population-oriented research and clinical trials that improves human health and quality of life and generates benefits for the economy, society, culture, national security, public policy, or the environment. So in this case, research impact is not only about having a positive impact on health, but it's also about other things. Bigger could be an impact on the economy, positive impact on the bigger society. So two concepts that are related to evidence-based public health: research translation and research impact. Next. And so, if this is our framework for evidence-based medicine, next. This is what we have for evidence-based public health. And this figure I borrow from Brownson et al., who published in the Annual Review of Public Health in 2009. So both of the figures are similar, but are also different. In evidence-based public health, we are also aiming for the intersection of the three dimensions, except that this time, the dimensions are bigger. While we draw from the best research evidence available, we are looking at communities and populations rather than individual patients. We tap into the expertise of public health experts, not necessarily doctors alone, because public health is not just for doctors. It's multidisciplinary, while keeping in mind that all of that happens within the bigger context of an organization or of a society. So that's our framework for evidence-based public health. Next. Perhaps this is one good way to visualize the pathway for evidence-based decision-making. I borrow this from Professor Don DeSavigny, one of my professors in Basel. What does his framework say? So we begin with the data above. Data, whether quantitative or qualitative, it only remains as data without meaning. It's just a number, which probably it's just a word or a phrase. It only becomes meaningful when we analyze it. So when we analyze, compile the data, then it becomes information. And that information is not yet evidence. It's just information. But when we integrate the information, interpret, and evaluate it, then it becomes for us evidence. And that evidence is not yet knowledge. It becomes knowledge when we format it in such a way that we can present it to planners and stakeholders so that they uptake the evidence as knowledge. And then it does not influence decisions yet. We have again to convert that knowledge into something. So use that knowledge to influence decision making of our policymakers. And so decisions are made, but there is no impact yet because you have to implement what you decided on. And when you implement the decision, then you get the impact. It could be positive, it could be negative, because impact is not always positive. But how do we know and validate that there was impact to begin with? We have to monitor again, identify the indicators, and measure the changes. So again, it goes back to data, and the cycle goes on and on. So I really like this pathway because it's a good summary of how you start with data, and then you generate knowledge and use that knowledge to influence decision making. Hopefully, the decisions made produce impacts that are positive for the health system. Next slide. And so let's compare evidence-based medicine and evidence-based public health. Again, both emphasize the use of evidence, but they're quite different. And I did it in a way where we try to differentiate them based on certain characteristics. So let's start with the scope and aim. For evidence-based medicine, what is the scope? So this is really medical and clinical practice. And our aim is to keep individuals healthy. Whereas for evidence-based public health, The scope is obviously public health practice, and the aim is to keep populations and society healthy. Next. What about the sources of evidence? Ideally, for evidence-based medicine, we rely on randomized controlled trials. These are the most rigorous of the study designs, and they really give us results that are with minimum bias, okay? Results that are valid. So that's for evidence-based medicine. However, for evidence-based public health, while we also value randomized controlled trials, we do know that randomized controlled trials are not always feasible. And so other study designs may also be useful for generating the evidence required. So, for example, in assessing the effectiveness of a vaccine, you can do an RCT with that. That pretty much falls under the category of evidence-based medicine. Let's think of something for public health. Say, let's talk about supervision of health workers. The theory is that if you supervise health workers, they perform better. So if you provide good supervision, how do you generate the evidence for that? Sometimes it's not always an RCT, and you have to explore other study designs that may be used so that you generate the evidence that will be relevant for public health practice. Next. Let's look at the decision makers. So in evidence-based medicine, mostly medical practitioners and other health-related professionals. For evidence-based public health, it's more multi-sectoral. In fact, it's not just the health professionals. Social scientists are involved, anthropologists are involved, economists are involved. Okay. Next. And in terms of the level of complexity, as we already said, EBM deals with the human body, which is complex in itself, whereas for evidence-based public health, we are dealing with health systems which are complex, adaptive, and on certain times unpredictable. Next. So we now live in a time when we have to think differently about health systems. Before, what was popular was linear thinking, as you see on the screen. This type of thinking is simplistic and consequential. Basically, what it says is that if I do A, and then it leads to B. So it's linear. Next. However, systems thinking is a deeper understanding of behavior of health systems. A system is always changing. It's made up of multiple components that are always interacting with one another. And it's not always easy to understand and to predict the ways by which an intervention might affect it. We might be able to move one dot there, but sometimes we do not know how that dot will interact with the other dots. And so that's the complexity behind systems thinking. Next slide. You can read more about systems thinking for health systems strengthening. Next. I think this is a nice reference. It was published in 2009 by the Alliance for Health Policy and Systems Research of the WHO. And if my memory serves me right, it remains to be one of the most downloaded WHO documents from the WHO website. And this photo is our class picture with Professor Dawn Desavigny. Dawn authored this paper on systems thinking. And this was one of our summer classes in Lugano, in Switzerland. Okay. Well, he just retired last year. I think he just retired. Next, we do have existing frameworks that can help us understand or analyze health systems better. This is one of my favorites now. One way to imagine the health system is by imagining it as having control knobs. So this is a framework that was conceptualized and developed by Michael Reich and others, the Harvard School of Public Health. So what does it say? Well, it says, if we look at the health system, first let us identify those control knobs. You know control knobs, no? You move them clockwise, counterclockwise, and it's supposed to, like a volume in the old music players. No? Turn it a bit and it should result into something. So they proposed this framework. We can look at control knobs, say it's not very clear on the screen, but I hope you're able to appreciate. So for example, the control knob of financing, payment, organization, regulation, and behavior. So how much are we supposed to move those? And then by the way we move those control knobs, they result to certain efficiencies, changes in quality of services, changes in access to health services as your intermediate performance measures. And the changes in those measures then leads to changes in your performance goals. Does it lead to improved health status, better customer satisfaction, better risk protection? You may look for this framework. It's available online. So just Google the Harvard World Bank framework on health systems with control knobs. Next. I think the other and more popular framework is the 6 building blocks framework. Many of you are familiar with this. Developed by the WHO. And essentially what it says is that we can imagine health systems as composed of 6 building blocks. Okay? The building blocks of governance, healthcare financing, health workforce, medical products and technologies, information and research, and service delivery. And we focus on those building blocks and improve those building blocks. And together, those building blocks should lead to your goals or outcomes from the health system. Could be improved health equity, better responsiveness of the health system, better financial risk protection, improve efficiency. In fact, we can try to use this framework when we look at UHC in the Philippines. So for example, next slide. So we already have an ambitious UHC Act, and the UHC law in this country has so many components. And by using, for example, the 6 building blocks framework, we can identify some of the components in the UHC law. For instance, simplifying membership into 2 types, direct and indirect contributory, the pooling of funds to PhilHealth for individual-based health services. So we pull together the funds from the syntax, PAGCOR and PCSO. So what building block is this? We might consider this as part of the financing building block. Next. We also have this in the UHC law, clarifying the roles between DOH and LGU for population-based services and PhilHealth for individual-based services. And under the law, we're supposed to consolidate fragmentation by establishing province-wide and city-wide health systems. So what component, what building block would this be? We might think this could be the building block for governance. Okay. Next. We also have the acceleration of primary care as part of our UHC law. So what building block would this be? We can think of it as the service delivery building block. Next. And then one important component of the UHC law is the institutionalization of health technology assessment and also health impact assessment. In other words, a process wherein HTA allows the assessment of products and services before they are actually purchased and delivered, okay, by the government. And we can think of HTA, in fact, as a very good example of evidence-based policymaking. And when we think of a building block, going back to the framework on building blocks, you might say that this falls under perhaps medical products and technologies, okay, that particular building block. Next slide. I'll borrow this figure from Brownson and others, published in 2009 in the Annual Review of Public Health. So we can imagine, now going back to evidence-based public health, we can imagine it as a cycle where number one, we will do community assessment, after which you quantify the issue, and then develop a concise statement of the issue. Then we determine what is known through the scientific literature. Next. I think that's lacking, so I added further studies. You don't just review the literature, because when you find out that something is missing in the literature, then you do further studies to contribute additional evidence. And based on what the literature and your study results say, you develop and prioritize program and policy options, and then develop an action plan to implement your interventions. And then you evaluate your program or policy if it was effective. And then the cycle goes on again. Okay, so I'd like to propose that we can imagine evidence-based public health as a tale of two worlds. Next. One of those worlds is the world of evidence generation. So part of that cycle involves a lot of researchers who are part of this world. This is the world where you generate the evidence. Next. The other half of that cycle, you might say, is the one that involves our policymakers and program implementers. I'd like to call this world the world of policies and programs. Next. There is an imaginary boundary between the two, although of course the steps here almost always overlap. But there are two worlds, okay? Researchers on one side, policymakers and program implementers on the other side. Next. Let's first talk about the world of evidence generation. Who are the actors? Researchers. What's their primary interest? They want to generate knowledge. They want to find answer to research questions. Where do we see them? They're in the universities, research institutes, think tanks. What are their outputs? They publish, they aim for citations. But I should say we, because I'm part of this world actually. We produce scientific reports, present in scientific conferences. Next. Sometimes, and I say sometimes in parentheses, there's also a critical view of this world. What is that? The researches that are being developed and implemented have minimal or no inputs from potential end users. The other thing is that research findings sometimes, I say sometimes, not always, research findings not easily understood and are not useful for the current needs of health policies or programs. Next. Kaya minsan, di ba, ang criticism sa world na ito is that research ng research pero wala namang gumagamit ng results. Sometimes that's true. Next. And that is why we have this, what we call Finagle's law of information. The data we have is not the data we want. Next. The data we want is not the data we need. Next. And the data we need is not available. Next. Let's talk about the other world, the world of policies and programs. Who are the people here? Policymakers, program managers. Their primary interest? Develop the policy, implement the programs. Where do we see them? Ministries of Health or Department of Health, local health offices, multilateral, bilateral agencies, civil society organizations. What are the expected outputs? Laws, public policy issuances, health programs. Next. Sometimes, and I say again sometimes, the critical view of this world is that policies and programs are developed without sufficient support from evidence. And the other thing is that policies and programs are implemented and continued without clear effectiveness. Next. Kaya nga di ba minsan ang criticism naman for this world is that gawa ng gawa pero wala namang proof that it works. Next. Perhaps I don't have to explain this, but these are photos that offer examples of what I'm talking about. And you and I know that we also have local examples, but I will prefer that I will not be specific. And I'm sure that many of you are aware of already of some of the local examples that we have. Okay, next. So again, there are two worlds, the world of evidence generation and the world of policies and programs. Next. What we've been talking about is that evidence should be informing the policies for health. That is evidence should be informing the policies for health. That is evidence-informed public health. Next. Sometimes what is missing, however, is that it has to be a two-way street. But while we need evidence to inform the policies, we also need practice to inform health research. I think that is one way to solve our mismatch. Okay, while we will endeavor that the evidence from our researches is used to improve policies and programs, the researches that we do should also draw from what is lacking in our public health policies and programs. Next. So what should researchers do? And these are my suggestions. Well, one is that we develop a research agenda that is policy relevant by involving policymakers or program managers in the process. Next. We have to perform well-designed researches that generate valid results. And maybe I should be blunt. Sometimes there are researches that are not done well. So if we don't do our researches well, the results that we generate are also not valid results. So first, we also need to do researches very well so that we generate valid results that can be useful. Next. And we need to communicate and advocate our research findings in a manner that can be appreciated by policymakers and program managers. Next. We can establish institutional partnerships with policymakers and program managers. For instance, inviting public health practitioners as guest lecturers in academia. This is something that I will show again later. Next. And researchers should go beyond publications. We need to ensure the relevance of our research through the utilization of our researches for policy and program development. Next. So some examples. To be fair, and I'm really happy that we actually have a very sophisticated way of determining a research agenda for the Philippines under the National Unified Health Research Agenda, spearheaded under the Philippine National Health Research System, which includes both the Department of Science and Technology and the Department of Health. So every year, well, not every year, but during certain periods, we, through DOST-PCHRD, the research agenda for the country is determined by both a top-down and a bottom-up approach. So the National Unified Health Research Agenda should guide our health researches and development efforts in the country. And next. For our current NURA, these are the topics that are prioritized, as you see on your screen. And one of them is responsive health systems. And you also see there the topic on research in equity and health. Next. We are, however, still lagging in terms of publications. I quickly search Scopus. And this is showing you the number of Scopus publications for 6 ASEAN countries per year. And we see that the Philippines is just averaging about 3,000 to 500 Scopus publications per year. Indonesia has amazingly produced a lot in recent years and has gone up. But if we analyze this based on per capita population, we will for sure see Singapore at the top. Okay, so we're a bit lagging behind when it comes to scientific publications in reputable journals that are indexed in either Scopus or Web of Science. Next. And we know that the scientific publications matter a lot in the ranking. So this is the top 10 institutions based in the Philippines with the highest number of Scopus publications as of the end of 2019. And this is cumulative, so total number of Scopus publications until the end of 2019. And as expected, UP Diliman is at the top, and we know that the output from Scopus is seriously considered in the university rankings. And that's the reason why the UP system, as expected, is almost always the top university in the Philippines when it comes to these rankings. Next. I do, however, want to add that while university rankings rely so much on the quantity of publications and citations, perhaps we also need to assess academic impact beyond publications and citations. And one of the ways to do that is also to assess research translation, which is not very easy. It's easier to count publications and citations because there is a system for that. You just count using Scopus or Web of Science. But what about research translation? I don't think there's currently a system where we can easily count how many times a research paper was translated into policy or programs. But we can maybe get some examples from the literature. Next. For example, this is a paper, open access, so you can read this for free, published in Health Research Policy and Systems. And here, Searles et al. Were proposing a framework. They called it Framework to Assess the Impact from Translational Health Research, or FAIT, F-A-I-T. They have a framework for a metric where you include research translation in one of your metrics to assess impact. Note, however, that a key assumption of the team here is that when they developed this framework, they were emphasizing that research translation is a prerequisite for research to have impact. Next. And this is how their framework looks like. So what is important here is that early on, when a research project is carried out, you already identify what your metrics are. And one of the metrics here is, for instance, legislation and policy. And this is in fact a scorecard, okay? An example of a scorecard they did for research program that aimed to reduce unnecessary ER visits by residents of an aged care facility. So you put their legislation and policy, and then you count how many times the research paper was cited in a policy document. And then you also indicate what the various policy issuances or guidelines are that were based on your research work. If somebody will enforce this for research projects, then researchers will be forced to do it. And we will have a clear metric for measuring research translation, which goes beyond a simple way of counting number of publications and citations. Next. We need to build capacity for doing policy briefs, and researchers ought to be able to do very nice policy briefs. And the key here is that it's supposed to be brief, so 1 page or 2 pages of a policy brief. And we have to do better in terms of visualizing information in a simple way so that policymakers and program implementers can appreciate them better. Next. Researchers have to be able to communicate more effectively as well. So talking to the press, just like Dr. Anthony Fauci in the US, or maybe using social media to spread their message, just like my former boss in UPNIH, Dr. Edsel Silvania. So researchers also have to be equipped with the skills for effective communication. Next. And we have to be advocates. This is Dr. Tony Dans, getting Senator Manny Pacquiao to be an advocate for anti-smoking, and he has the anti-smoking champion belt. So we need to develop that skill also so that we can effectively advocate and convince our decision makers to support us in our advocacies. Next. Well, some universities abroad have, in fact, dedicated centers for research translation. For example, in Harvard, you have the Division of Policy Translation. I am not sure if we have an example of something like this in the country. Maybe it's something to consider, where you dedicate a center whose mission is to accelerate the translation of research projects into policies and programs. Next. Another good example, I think, Ateneo School of Government. In the school, they have a lot of lecturers who are actually public health practitioners. So you invite people in the Department of Health to teach the courses, to engage the students. In fact, many of your students also come from government. And the photo here is, in fact, having our USEC Mario Villaverde, as a part of the faculty in the Ateneo School of Government. Next. Now, what should policymakers do on the other hand? So earlier I was talking about researchers. Now let's talk about policymakers. Well, identify policy relevant gaps and partner with researchers to address these gaps. Next. Secure budgets for policy relevant research. Next. Ensure that every policy or program draws from the best research evidence available. Next. Establish institutional partnerships with researchers. For instance, host research fellows. Just like what happened to me. You know, I'm a researcher, but I'm being hosted by the Department of Health. Next. And ensure program effectiveness through constant assessment of the evidence. So for researchers, I think the focus is relevance. That we try to ensure that our researches are relevant. And for policymakers and program managers, endeavor that the programs and policies are effective. And you will be able to tell that if you continually assess the evidence for the effectiveness of the policy or program. Next. And there are actually very nice efforts already happening in this area. In the Department of Health, we have AHEAD, accelerating UHC through health policy and systems research. And then every year, you have the Department of Health organizes this Health Research Forum for Action. So under AHEAD, DOH working with PCHRD identify the priority topics and then engage researchers to work on the topic. So they have funding actually for priority topic. So this is nice because the DOH is determining what researches have to be pursued based on what it needs, so that the findings can be used to improve programs and policies. And then the findings from the researches that have been funded are shared in what we call research to policy dialogues. And this is a very nice platform for researchers and policymakers to engage each other and exchange ideas on how they can translate the research into action. Next. There are good models for hosting researchers in public health agencies. Personally, I find the Thai model very effective, and this is the International Health Policy Program in Thailand, which is hosted by the Ministry of Health of Thailand. And the man behind this program is Dr. Viroj Tangcharoensatin. many of you or some of you probably know him. He's an amazing guy, and we've also had the chance to work with him on certain occasions. So I am joined here by Dr. David and Dr. Eileen Pascual of Ateneo School of Medicine and Public Health. So they host fellows. They recruit young people who have an interest in health systems and policy research and provide them mentorship. Some of them go to grad school. And these are the people who then populate the Ministry of Health. And so you see, these people are trained in health research, and then eventually they become the policymakers and the program implementers. So we see a very nice way of bridging the gap between research and policymaking here. Next. In fact, we also have this sort of fellowship in the Department of Health. And some of you may be aware of the DOH Health Policy Fellows. So it's also like what Thailand is doing. And the program has been modified so that we now recruit from our regional centers or from our CHDs. And the photo below shows you the current batch of DOH Health Policy Fellows who come from our CHDs. And I think some of them are actually joining us in this webinar. Next. We have the Balik Scientist program. It's funded and managed by DOST to incentivize Filipinos who are based abroad to return to the country. And this is a table where we see the number of Balik Scientists for 2019. Although perhaps we need to expand so that we can bring more Balik Scientists in other parts of the country, not just NCR. But oftentimes the Balik Scientists are hosted in academic environment in universities. So by hosting the Balik Scientists, for example, in national government agencies that actually do the policy, perhaps we might be able to see an enhancement of evidence-informed policymaking. Next. So for instance, I am really very happy that I've been placed in the Health Human Resource Development Bureau since last year. And I've been working with very amazing and pleasant people. This is a bureau at that time under director, now ASEC, Kenneth Ronquillo. And so the bureau's mandate is to strengthen the health workforce for the country through policies that will be developed to protect the health workforce, build their capacities, etc. And so COVID-19 happened. Next slide. One of the things that I was honored to assist the Bureau was the projections for the health workforce requirements for COVID. So as early as March, when we were having our cases, the Health Human Resource Development Bureau already aimed to estimate the number of health workers that will be required for the country. And at that time, way back in March, we were looking at various scenarios. And by our own research and computations, we came up with about 15,000 required HRH. Next. And you probably saw that in the news sometime in March, or was that April, that the Department of Budget and Management has approved the hiring of additional health workers for the Department of Health. And these are not volunteers, by the way. These are health workers who will be hired with complete salary and with a full range of benefits under the Bayanihan to Heal Act. And I think this is a nice example where the research was able to help inform the policy. Next slide. Because there was in fact a policy on emergency hiring, and this is Department Memorandum 2020-0153. It put in place the guidelines for the hiring of additional health workers to assist our hospitals in addressing COVID-19 adequately. Next slide. I'm a bit over time, but I will wrap up. So just a few insights on ways forward. So again, we have researchers on one side, policymakers, program managers on the other side. And we need both to be working closely together. For instance, in research priority setting, researchers, we determine what is the gap based on the literature, what is missing in the literature. Then we identify those gaps. On the other hand, policymakers, program managers, they determine the research priority based on what is the gap in their policies and programs. And for researchers, they need to engage policymakers to set together the research agenda. And for policymakers, they need to provide funding for research that will address the research agenda. Next. Research capacity. As I said, researchers need to enhance the quality of research, and hopefully they publish. And for policymakers, they do not necessarily have to do the research themselves, but it would be nice if they themselves also appreciate the rigors of research methods so that they understand what the results indicate or signify. Next. Research dissemination. We hope researchers could present in scientific conferences, but not only. We need to enhance capacity for communication, example, policy briefs, skills for advocacy, skills for engaging the media effectively. And for policymakers, we hope they could facilitate research to policy dialogues. Next. Now, for policy and program development, researchers, we need to appreciate the rigors of policy and program development. So we know how it is. It's not always easy. This is one of the things I learned in the DOH. Of course, policies and programs need to go through something. So we need to understand that as well. And hopefully we include policy translation in assessing the relevance of our research. Now, policymakers and program managers should endeavor to enhance the quality of their policies and programs, and hopefully include the use of evidence in assessing the effectiveness of their policies and programs. Next. And partnerships. Researchers hopefully engaging policymakers and program managers as teachers. And on the other hand, policymakers and program managers hosting and embedding researchers and fellows in policy and program environments. Next. So it's really the two worlds working together. And we might imagine it as, push and pull, researchers pushing policymakers to adopt the research findings and pulling them to support evidence generation. And then on the other hand, policymakers pushing researchers to do relevant research and pulling them to work with them. Next. And if we do it together, then hopefully we facilitate evidence-informed policymaking for health. And sometimes policy decisions have to be made in a matter of hours or days. And we cannot always wait for a policy brief or for a publication before we can decide on something. So if researchers and policymakers are always working together, then a simple call to a friend in the academy may be able to help the policymaker to reach a decision. Next. So, all right, I'm ending. So just to summarize our goal and learning objectives. So again, the goal of this session, of this lecture, was for you to gain a conceptual understanding of evidence-informed policymaking for health. And specifically, we described the process of research translation into policy and vice versa. Remember that it is a two-way street. Identify the issues that affect evidence-informed policymaking, and hopefully apply these concepts to enhance the effectiveness of our works, whether as researchers or policymakers and program implementers. Next. So I'd like to ask you the question, what is your role in evidence-informed policymaking for health? You might be in the academe, you might be in a policymaking body, you might be in the private sector. So if this is the the environment for policymaking. So I ask that you think about it, think of your roles, and what can you do so that we all work together towards facilitating evidence-informed policymaking for health, and perhaps the other way around also, public health practice informing research. Next. This is a nice website, and I recommend that you visit it if you want to find out more about evidence-informed policymaking. It's www.researchtoaction.org, and I think there are quite a number of very useful materials that you will be able to use and refer to for your work. Next. Well, I started with Switzerland, and I'm going to end with something related to Switzerland. I really like Crash Landing on You. It's probably obvious by now. And the original soundtrack of that K-drama has this very, very nice music. And the title of that music is Same Sky, Different World. So I'm going to end by saying that while I may have talked about two worlds, the world of evidence generation and the world of policy development and program implementation, I will say that we share the same sky. We share the same goals, one of which is to contribute to the efforts to keep our people healthy so that they can contribute to the development of our society. Next slide. So please do not forget the people we serve. Health systems are complex, but at the end of the day, we should also remember that people are always at the center of health systems. So maraming salamat po sa inyong lahat.
Thank you very much. Thank you very much, Dr. Harvy Liwanag. Indeed, same sky, different world. No? So we should play
It's
that.
really nice. The music is really nice.
Really nice. Yeah. So Dr. Harvy Liwanag actually gave a very comprehensive introductory lecture, which a lot of our participants actually enjoyed and liked. And you'll see the comments actually in the chat box, no? And he actually sort of linked the research translation program of the Department of Science and Technology with the presentation that he gave, no, which started out, of course, with the concepts surrounding research translation and moving into the actual policy-making process. So we have a lot of questions. So I grouped them actually into four main areas. I'll ask the first two main clusters of questions, and then later ask the second set of questions. The first set relates to some clarifications regarding your lecture, Harvey, on evidence-based medicines and evidence-based public health. There was a question whether this should be a two-way process from the evidence generation to the actual implementation of policy. And then there was also a clarification on what other study designs, no, could be, would you suggest, or can you mention, aside from RCT, with regards to evidence-based public health. And there was also a comment regarding evidence-based public health. If you have encountered, and what is your comment regarding evidence-based One Health instead of evidence-based public health? So, so those are the sort of clarifications regarding the evidence-based medicine and evidence-based public health. Now, moving to some comments relating to national government agency programs, there was a comment actually that are we not referring to the DOST 6 Ps? The DOST 6 Ps as one of the sort of parameters for saying, or one of the indicators for saying that we are indeed doing research translation. And there was also a comment that policies actually result from several researchers, but not just one research, no. And then a comment or a commentary on the policymakers being selective sometimes and not being able to actually read the recommendations, but actually decide in favor of certain preferences or agenda. So I tried to collapse them because there were a lot of questions, but I tried to collapse them around those areas to be able to allow Harvey to be able to respond to those in a more perhaps integrated way. Harvey, over to you.
Thank you very much for the questions. Quite a lot of questions. And for me, when people ask questions, that means they're interested in the topic. So I'm happy when people ask questions. So perhaps let me address the first set of questions. So there was a question about the two-way street. So in my presentation, I think I emphasized that indeed we should look at the process as a two-way street. Researchers on one side and the policymakers and program managers on the other side. Both sides informing each other. So I think sometimes the problem is that we sometimes think of it only as a one-way street. In fact, the term evidence-informed policymaking sometimes sounds like it's linear in one way. So hopefully by thinking of it this way, while we call it evidence-informed policymaking, we are also cognizant of the fact that it should be a collaboration always. It's not just the researchers telling the policymakers what to do. It's always a conversation and a dialogue. It's always a relationship. So, and the relationships are always mutual or two-way. The question on study designs, thanks for that question. Maybe we should reserve that for Wednesday when we do one of the lectures, and we will talk about some of the study designs. Of course, different study designs have different weights of evidence. And so when we are not able to do an RCT and we do other research study designs, we have to interpret the results knowing that the results they generate may not always be as valid as what you might get from an RCT. But then again, that does not make them not useful. For instance, cross-sectional studies. Definitely cross-sectional studies, the results you get there are cannot really show effectiveness. Okay, you can clearly show effectiveness with an RCT because you have randomization, you have a comparative group. But that doesn't say that you're not supposed to do any cross-sectional, because it doesn't mean that cross-sectional studies are useless. We'll talk more about that on Wednesday. Evidence-based One Health. I think I've read of this somewhere, but I must admit I'm not very familiar with this term yet. So my apologies, but I will look into it. But I do know that One Health has something to do with looking at the whole system that is connected. Then maybe if we look into this concept, then I guess the principles that will be articulated by this term is similar to what we want to have for evidence-informed public health or evidence-based public health. For the second set of questions, yes, we do have DOST 6Ps, and I think Miss Ullyann Garcia is listening, so perhaps we can address this in the next open forum, because Miss Garcia will be describing to us the current initiatives of PCHRD. And I know that 6Ps is one of the things that PCHRD is currently doing. So we can ask Ms. Garcia to address that question. Policies result from various researchers. That is correct. Science is about building a body of knowledge, and oftentimes we don't really just depend on one single research paper or research project. And every research project, in fact, builds on what has been previously written. So if I do a study on a particular topic, I'm not starting from scratch. It's also in reference to what has been studied about this topic in the past. So by But thank you for pointing this out, because if we endeavor to have researchers and policymakers to work very closely together, oftentimes it's really the researchers who are pretty much familiar with the landscape of the research that has been done for a particular topic. So if there are sudden questions from our policymakers on certain things, and if they are in close contact with the researchers, then our researchers will be able to draw from what they know from the literature. And hopefully that is able to help them develop a policy that is relevant and something that will address the needs of our policymakers. Yes, policymakers can be selective. In fact, researchers can also be selective, if I may be allowed to say that. We have our own biases, but it's a challenge, of course. How do we convince policymakers to really use the best evidence out there? Hopefully, this question can be further addressed by our lecture on Wednesday with Dr. Jason Ligot talking about effective communication. And I guess we will again touch this very briefly when I go back later for my next lecture when I talk about effective research translation.
Thank you again, Dr. Harvy Liwanag. So as Dr. Liwanag said, no, there will still be other inputs that will be given after his lecture today, and also on Wednesday, and there's going to be presentations also on Friday. By the way, we have 1,100 plus webinar participants joining us this afternoon. Thank you for joining and participating in this webinar series. I'll summarize, or I'll cluster again the next set of questions relating to the LGU context, and also some comments and queries about the COVID context. Regarding the LGU context, there has been some requests or some questions on examples of how LGU policies being influenced by research, by evidence-informed studies. Also, some comments on the policymakers, specifically also LGUs, listening to policy recommendations or other policy health professionals. Is that the way policymakers usually decide, or how do they usually decide? There are some comments regarding role of comments on role of ethics into research, and also funding, specifically the amount of budget or funds that is being allocated for research being a factor into the number of researches being produced. Finally, there are some comments related to the COVID situation, specifically what recommendations from the public health experts are being can be given regarding the pandemic. And there was a specific question also on schooling, on the how blended learning, for example, can be of value to the current pandemic, with specific focus to certain groups, like the younger generation who need more social interaction, and the GIDA, or geographically isolated and disadvantaged areas. I think this is more of a very practical issue that some of our viewers would want to get some insights on as we approach the opening of classes, and also the current restrictions that we have regarding COVID. So I think that will be the last set of questions, Harvy, and then after that we'll proceed with the input from Ms. Ullyann Garcia, and then to the rest of the webinar session this afternoon. Back to you, Harvy.
Thank you, Doc Dennis, for the next set of questions. Ang daming tanong, but I appreciate the questions. And again, thank you so much to all of you who join us today. We've reached 1,000. participants, and we're really very happy. And we did not imagine that this webinar will expand into something like this. Okay, so the question on LGUs. Well, we're a devolved health system, as you know, and decision making is really at the local level is with the LGU, and it's really a challenge. I don't have an easy answer to this. We are aware of a number of examples where we see local chief executives refusing to use the evidence that is in front of them. What do we do with that? It's something to discuss further, but how do we maybe make LGUs accountable for the decisions that they make? Say if they try to initiate a program or fund something that is clearly not supported by any evidence, but nevertheless they decide to do it anyway, and it results to, say, people being harmed. How do we make them accountable for that decision? So maybe the accountability dimension has to be explored. They have to be responsible for what they decide on. But at the same time, I'd like to say that we also have several examples of LGUs that are doing very well. Pasig, for example, has a very good mayor. Manila, your has a very good mayor. So it's really the quality of the local chief executive, and I do not have sufficient answers for this, but maybe this is something that will be nicely discussed better with when we engage political scientists and psychologists. So that's how I will answer the question. Well, ethics, I wasn't really sure what the question on ethics was, but let me just say that, of course, every research undertaking has to be ethical. And so that is why, under the leadership of PCHRD also, we have initiated and established a ethics review system in this country, and we have increased the number of research ethics committees across the archipelago. And this is a way for us to ensure that whatever research is done there should be screened prior to implementation so that they adhere to the highest ethical standards. Funding on research. We do have plenty of funding for research, and I think this is something that researchers should, this is an opportunity that researchers should maximize. PCHRD has funding, DOST has funding, certain institutions probably have funding. There are also foreign funding. So it's also a skill to look for opportunities where to source your funding. So sometimes it's important that you have these connections with the agencies so that you are well informed that by this certain day there will be an announcement for a call for proposals, etc. And sometimes it also helps that you subscribe to certain newsletters so that you get updates for new calls for proposals. And sometimes what I do, I just go on Google. I go on Google and then type, let's say, call for proposals, health equity, or something like that. And then you see all sorts of announcements there. So I can tell you that we do have a lot of funding opportunities out there. It's really just a matter of choosing the right one and being able to write a competitive proposal so that you secure the funding for that. Regarding COVID-19 situation and the opening of the schools, I am not the competent authority to answer this question. But I am sure that the Department of Education is, and CHED maybe, is working on something to find a solution for the opening of the school. And lastly, on GIDAs or GDAs, are geographically isolated and disadvantaged areas. This area should be our priorities in what we do, whether in research or in the interventions that we will implement. And this is also in the context of advancing UHC. We do not have UHC if our GDAs are being left behind. And maybe to connect that with our current eTURO session, well, assuming there is good internet connection in the GDA, then maybe this is one platform also to explore so that we can reach them and offer our learning sessions and include them in our webinars. I don't have all the answers for your questions, but thank you so much for your questions because I'm also learning.
Thank you very much. Thank you again, Harvey, and we'll give you some time to rest, no?
Thank
Before
you.
we introduce you again later to the to your second lecture. And as Dr. Harvey said, some of you there will still be sessions on Wednesday and on Friday. So some of the questions that have been raised will have the opportunity to be discussed again, no, on Thursday, on Wednesday and Friday. And with that, I'd like to introduce Miss Ullyann Garcia, who will provide us updates from the DOST-PCHRD on current and future initiatives in research translation. As we all know, this particular webinar workshop online at that is actually a project of the Research to Policy Translation Unit of the Department of Science and Technology, Philippine Council for Health Research and Development. Ms. Garcia finished her BS and MS Development Communication at the University of the Philippines in Los Baños in 2002 and 2019, respectively. She has been with the PCHRD since 2003 and is currently the head of the Council's Research to Policy Translation Unit, as well as the head technical secretariat of the Philippine National Health Research System. Prior to this, she also headed the council's communication team. So with that, I'd like to turn over to Ms. on the current and future initiatives in research translation. Over to you, Yuli.
Thank you, Doc Dennis. Just to quickly add some explanation po kanina dun sa open forum with Doc Harvey, just to provide a little background about the DOST-6 piece. So the DOST-6 piece aims to quantify all outputs, which will then be compared to the total budget of the project. So ang expected outputs from the projects to be funded may include any of the following. So these are the 6 P's. First is publication, contribution to the general body of knowledge through scientific publications. Second one is patent. So this is a tangible measure of innovation. Third one is product for the commercial value of outputs. And then we have people services, increase in the scientific workforce. Fifth one is places and partnerships, which includes facilities and networks that enable increased 6 P's outputs. And the last one is policies, adopted science-based guidelines. So, connected po yung last, yung policies sa atin pong i-discuss ngayon, which is the DOST-PCHRD current and future initiatives in research to policy translation. Next slide, please. Next slide, please. So, this is our very first activity for this year. We're supposed to hold a national workshop last March, but due to the COVID-19 situation, we had to cancel the activity. So this is our very first webinar virtual workshop series. And the objective of this webinar virtual workshop is to introduce early career researchers to the process of evidence-informed policymaking for health, its basic concepts, and how they may be able to apply these concepts to translate their own researches into practice. Next slide. So this was already shared by Dr. Harvy Liwanag. We have two groups of participants. We have the virtual workshop participants composed of researchers from the 17 RHRDC with completed or ongoing research with policy implications. And then we have the webinar participants, which is composed of other early career researchers, research managers, and stakeholders who are interested in evidence-informed policymaking for health. Next slide, please. And then we have the 3-minute pitch to policymakers competition. So we know that research has significant implications for the community, particularly in health. So a successfully completed health research study, especially with substantial results, must be communicated to policymakers and key stakeholders to empower decision making. In this light, it is important for researchers to know how to communicate research findings to inform and share evidence to policymakers. So this activity aims to exercise and cultivate the researcher's skills on communication of research findings and evidence-informed policy recommendations to policymakers. The researcher should be able to present their completed research in a 3-minute, one-slide presentation for a non-specialist audience based on set criteria. Next slide, please. So, the research to policy translation team prepares position papers to reflect the Council's stance on executive or legislative measures. And we also help our researchers to prepare policy briefs for completed projects with policy implications. The research to policy translation database, we maintain and update our database of PCHRD funded and managed projects with policy implications. So this serves as a policy adaption monitoring tool, reflecting the policy instruments developed, policy translation activities conducted, and the status of policy adaption. Next slide, please. So for future initiatives, next slide, please. So hopefully, we can conduct this national workshop on translating research evidence to health policy. This is a series of workshops to capacitate health researchers on research, translation, and communication strategies for evidence-based policymaking. And for expected participants, we expect 30 to 40 participants composed of researchers from each of the regional health research consortia. And we plan to hold this by regional clusters. Next slide, please. So we also plan to conduct policy dialogues or legislative forums, and PCHRD will invite program managers and policymakers to discuss policy recommendations on identified projects or programs. We will also invite the head of institutions where the researcher is affiliated to push for policymaking. Next slide, please. So for the monitoring of policy adaption, so we have the capacity building activities. And one of this is the webinar that we're doing right now. So the team, the Research to Policy Translation team of PCHRD will work closely with the consortia in monitoring policy translation of researches that were presented in the workshops. A conformal letter will be sent to the consortia to serve as proof of commitment in monitoring. For the 3-minute pitch to policymakers competition, winners of the policy pitch competitions will be connected through the help of the consortia to the target policymakers to facilitate policy adoption of their research findings. And we will also disseminate the policy briefs that will be produced, and policy adoption will also be monitored after policy dialogues were conducted. So that's my last slide. Thank you very much.
Thank you very much, Ms. Ullyann Garcia, no, for that presentation on the context, the current and future plans of the Research to Policy Translation Unit of the Department of Science and Technology, Philippine Council for Health Research and Development. So, Ms. Yuli started with the 6 Ps, which was actually raised in the Q&A part, no, of the first introductory lecture of Dr. Harvy Liwanag, and explained what these 6 Ps are, and then sort of described to us what are the different programs and activities planned for this year by the Research to Policy Translation Unit of the Department of Science and Technology, Philippine Council for Health Research and Development. So I think that also gives us a cue, no, on the next topic, which will be discussed by Dr. Harvy Liwanag. What makes research translation effective? This is quite interesting and intriguing as well, no? Because as we have seen, or what we have heard in the previous discussions, there are a lot of concerns or processes that we have to undertake to be able to conduct the research, and then more challenging would be translating the research to policy, and then probably the most difficult part would be how do you know or what makes your research translation effective. So with that, I'd like to give the floor back to Dr. Harvy Joy Liwanag on his second lecture on the topic, what makes research translation effective? Harvy, over to you.
Thank you, Dr. Dennis Batangan. I'm happy to be back. Okay pa ba kayo? And I see that we have 1,023 participants who are joining us at this very moment. So again, thank you for your time. This particular lecture will be shorter than the previous one. And basically, this is really just to explore the topic on how we can make research translation into policy more effective. So what makes research translation into policy effective? Next slide. Let's go back to Crash Landing on You, and hopefully we have plenty of people in the audience who have seen the series. So in one of those episodes, we see Yun Seri doing the what do you call this? The finger heart sign, right? Finger heart sign. And so she showed it to Captain Ri. Then the North Korean Captain Ri had no idea what it was. So, but it was actually Yun Seri's way of expressing her, giving her heart to Captain Ri. And Captain Ri had to ask his comrades what the finger heart sign actually meant. So he was perplexed. So the message was lost in translation. That's the point of this slide. So next slide, please. So our objective for this particular session is rather simple. No? It's just to explore some of the factors to consider in order to facilitate the effective translation of health research into policy. Next slide. We call it evidence-based policymaking, but when in fact, if you look at this figure, again from Professor Don DeSavini, we see that decision-making is really not a straightforward process, and there are plenty of factors that influence the process. You have peer pressure, you have budget consideration, you have politicians, you have donors pushing you to prioritize this over that, health workers advocating for their rights, you have media, NGOs, inertia, special interest, community, etc. So it's not straightforward, and that's the reason why, next, the term has been, in recent years, reformulated into what we call evidence-informed policymaking. the point being made here is that the evidence is not the only basis. The evidence is only one of the considerations. So even if the evidence is clear, decision makers, and this is reality, decision makers will have to consider multiple other factors. So, but the evidence informs. Okay. Next. So the point that I want to make here is that, well, with the term evidence-informed policymaking, it helps us become aware that the evidence is not the only basis, and we should be aware of the other factors affecting the decisions. And hopefully, if we have that awareness or recognition, then we become more savvy in the way we influence policymakers to adopt our research findings. It's really not just a matter of giving them the research product on a silver plate. So we also have to learn the skill of how to navigate the system and how to play with the various forces that are influencing the process. Next slide. So by the way, that's probably why we entitled the workshop Evidence-Informed Policymaking rather than Evidence-Based Policymaking. And we see it in the way some of our policies are being finalized. We have plenty of lobbying. These are some of the news articles. For example, the e-cigarette industry, of course, expectedly resisting tax. And Coca-Cola also resisting additional tax for sugar-sweetened drinks. So even if the evidence is there that if we tax these products, we promote healthy lives, and that's clear in the evidence, there are these forces that affect the process. And so it does not always result in a clear decision that is only based on the evidence. Next. So maybe we can learn a thing or two from what Sir Michael Marmot wrote in the British Medical Journal in 2004. Some of you may know Sir Michael Marmot as the one who introduced us to the concept of social determinants of health. In an article that was entitled Evidence-Based Policy or Policy-Based Evidence, he said, the relation between science and policy is more complicated. Scientific findings do not fall on blank minds that get made up as a result. Science engages with busy minds that have strong views about how things are and ought to be. Next. So for the policymaker or program implementer, what are the sources of evidence? It's not just the research evidence. There are so many other forms of evidence with varying degrees of validity. So sometimes they get advice by experts. We have consultants and think tanks. Sometimes you have professional organizations publishing position papers. And we have lobbyists and pressure groups. There can be evidence, quote unquote, from media. And we also know that there's plenty of fake news these days. Sometimes they get their evidence from the internet, social media, Twitter, Facebook, blogs. Sometimes they also get it from ideological evidence, from information pushed forward by ideological groups, information from political manifestos. We can have lay evidence as a source as well. This relate to what constituents or citizens experience. And we have street evidence, myths, urban legends, conventional wisdom. So policymakers are, and decision makers are faced with all sorts of sources of evidence. Next. And research evidence is not the only one. So the question that was raised during the open forum, when decision makers can be selective, that's really true, and that happens because they are faced with so many other sources of evidence. How then can we work together so that we can mainstream research evidence among all of these competing sources? And maybe that's one thing that can be answered further when we talk about effective communication on Wednesday. But this is something to think about, okay? That as we push for the adoption of our evidence, we are competing with all sorts of other sources. Next. The other thing to consider, of course, is first, well, to begin with, sino ba yung gusto nating i-engage? Who are the policymakers or program implementers whom we want to adopt our research findings? We have to be clear on that. Si Secretary ba yan? Si USEC ba yan? Si ASEC? Si Director of the Bureau ba yan? Si RD ba yan? Yung Division Chief ba yan? Program Manager ba yan? Baka naman si Congressman yan or si Senator. Si Governor ba yan? Si Mayor ba yan? Si Provincial Health Officer ba yan? Or si MHO or CHO? So we have to think of that first. Okay, sino ba yon na gusto nating i-influence? And once we identify who the essential or the critical decision makers are, next. Perhaps one thing to consider, and this is something I borrow from David Hunter, is the understanding that knowledge transfer is based on a relationship model. So it's relational. While knowledge is context-specific and adaptive, the use of that knowledge and application of that knowledge relies a lot on the effective relationships that you have with the people who use the evidence. So knowledge transfer is not only a function of science, but also the degree to which the speaker is viewed as a credible witness and can win over an audience. So when I think about it now and I look back at my own experience, of course I've had many instances when my recommendations are not absorbed by my target end user, and that's a fact. That's the reality. But I don't dare burn the bridge or be abrasive in my approach, because that will even make it more difficult. So again, going back to the concept of a relationship, I think especially for the Philippines, this matters a lot. And sometimes we have to make the other person aware that by adopting this or by using this, he also has a share in the process. That the adoption of that evidence will contribute to the improvement of the work that he or she is doing. So dapat meron siyang share dun sa or ownership doon sa research evidence na gusto nating ipagamit. So a lot of this is soft skills actually. And in hindsight, you know, in our conferences and capacity building initiatives, rightly so, we focus so much on the hard skills, you know, how to do systematic reviews and meta-analyses, how to design your study, case control, cohort, cross-sectional, etc., how to write a paper. But maybe, well, for future endeavors, we also have to look into the soft skills. How do we build capacity for researchers so that they can navigate this environment and they recognize the relational aspect of translating the evidence into policy or programs. I was not trained for that, and I don't claim to be an expert in this, okay? Sometimes this is something that we learn as we go through life and we build our careers. But maybe it would be nice if, a certain course or a certain capacity building initiative can also look into this area. Next slide. So, identify the decision makers and understand the authorizing environment. So when I say authorizing environment, we have to engage those who can make the decisions. Sino ba yung may power to make it happen? Kasi baka naman yung research natin na gusto nating ma-adapt, ang pwedeng makapag-pa-implement yan is the governor, but we are only talking to, say, we're not talking to the governor, we're talking to somebody else. So this is a skill. We have to know who are we supposed to talk to? Who is the one who can make it happen? And then maintain the relationship with that person. Again, because research translation has a relational component. Next slide. So where else shall we look for evidence and what facilitates research translation? Of course, we have to look at the literature also. And next. There are a few useful studies. This is open access. You can Google this and you can download it yourselves. So, study by Van de Goor et al., published in Health Policy. And in this study, they interviewed stakeholders and they asked them for their perspectives on what are the facilitating and what are the factors that facilitate and hinder the use of evidence in public health policymaking. But the context of this is EU. So they interviewed people in 6 EU countries. Next slide. Well, this is one of the figures in that paper, and it's a busy slide. It's an overview of the facilitators and barriers for the use of evidence, and particularly, in fact, they were only looking at a very specific policy. It was a policy on health enhancing physical activity. But this is a very busy slide, and as you know, as we already established, health systems are complex. But there's a way, maybe if we focus on only a few aspects. So next slide. So in that paper, they describe some of the facilitating factors for research translation into policy, and they describe them in selected domains. So one of the domains is that they looked at the organization, the system, and the infrastructure. And according to that study, research translation is facilitated if you have the following factors present. There's clear support from the administration, and you have managers who have a positive attitude towards the process. You set a clear criteria for how the policy process should evolve. And then you have here training of personnel in using evidence for policy making. So I hope, in a way, this webinar is a contribution to this effort, even in a small way. And then tapping the media in framing the problems that have to be addressed. Next. Another domain is on access and availability of relevant evidence. So in this particular domain, they state the availability of tools and methodologies for timely, concrete, and practically available evidence. Sometimes naman kasi the tools are not readily available in the arsenal of the policymaker. So if there's a specific policy question, and the answer to that question will help improve the policy. Sometimes the research is not there, and then people have to look for it, or people are not aware that something has been done on the topic already. So again, I go back. If only researchers and policymakers are working closely together, then maybe those delays can be addressed, and the evidence can be made available right away whenever they're needed. The other component is the availability of funding for tailored research evidence. So this is similar to what DOH is doing with AHEAD, where funding is actually provided for specific research questions which the department wants to address in order to fulfill its needs. Next domain. Networking and collaboration between researchers and policymakers. We have touched on this previously in the last lecture. So again, creating cross-sector cooperation, seminars, conferences, where researchers and policymakers meet to facilitate developing a joint language and reference framework. So it might be good when seminars and scientific conferences are organized that we also ensure that the event is not limited to researchers alone, that we also endeavor to have policymakers and program managers come over, that we can engage them in the adoption of our work. Next domain. And of course, they have a domain here that says country and context specific factors. So again, it actually varies depending on the setting, depending on the context. And this is a list of factors that comes from Europe. So I don't know if this is the same for the Philippines, but I'm sure when we look at the list, we can relate to many of these. So maybe there are concerns that are actually universally shared across the world. And it would be interesting if somebody will in fact conduct a study and look into these factors that facilitate or hinder the translation of research into policy, particularly for the Philippine context. Next slide. There are other papers out there that can help us, and this is another paper. Also open access by Trico et al., published in Implementation Science. The previous paper was a survey of stakeholders. This particular one by Trico is a scoping review. So this group looked at the literature and scoped the literature for studies on research translation, and they've identified some of the barriers and facilitators. Next slide. It's a huge paper, and there's a huge table there. And I will not discuss the table today, and I will leave it to you to take a look at the paper and read it during your free time. But in this particular paper, it's nice because when they reviewed or scoped the literature, they tried to organize the facilitating and hindering factors according to the following: attitudes, knowledge, skills, and behavior. And I hope that you will find the time to read this paper further. And hopefully the findings that they have here can help you with your work, whether you are a researcher or a policymaker, so that together we can advance evidence-informed policymaking for health. Next slide. Additional resources. So those of you who are familiar with the Cochrane collaboration, it's organized into different groups depending on the topic of interest. And I think for health systems and public health practice, one of the relevant Cochrane groups is the Cochrane EPOC group. It's the Cochrane Effective Practice and Organization of Care group. I think one of the centers is based in Oslo, Norway, with Simon Lewin. And we've had a chance to work with him very briefly in the past. So here you can go to the website. The link is shown on the screen. You can just Google Cochrane EPOC, and there you will find some resources for evidence-informed policymaking. And hopefully you will find them as well useful for your work. Next. So this is a short lecture, and we're supposed to end at 4:45. So again, the aim of this short lecture is to explore some of the factors to consider in order to facilitate the effective translation of health research into policy. And I hope that you were able to achieve that objective for this particular session. Next slide. So again, maraming salamat po, and we welcome your feedback and questions to me and to Ms. Garcia.
Yes, thank you very much again, Dr. Liwanag, for that short and sweet lecture on how do you know it's effective, no? Well, there are a few questions we have, no, for both of you. So I'll start the first set of questions, and I'll sort of summarize them all together so that you could have more opportunity to respond to them in a more integrated way. So for Yuli, I wanted to ask as well, no, what led PCHRD to decide in creating the unit, the research policy translation, research to policy translation unit, and what is the role of the regional consortia? No, because I noted that you are working very closely with the regional health research development consortia in the different regions with regards to this objective of this particular unit. And the final related question would be, how do you relate to the local government units? So specifically the LCEs or local chief executives with regards to the objectives and activities of the unit. Yuli?
Thank you, sir. So, to answer the first question, why did PCHRD come up with this kind of webinar? So, unang-una po, the PCHRD, through its Research Information, Communication, and Utilization Division, we recognize the role and importance of research translation to ensure that research contributes to evidence-informed health policies and actions. So kaya po may mga programa kaming inilalatag on research to policy translation, and this is one of the activities na na-identify namin. So yung for the second question, sir,
yung regional health consortia?
The regional health research consortia, we always work with them in terms of yung capacity building, and also for this particular endeavor, yun pong adoption of policies na magiging resulta ng atin pong mga capacity building activities on research translation. So we will need their help in terms of policy adoption in the regional level. And doon naman po sa last question, sa to reach our local local chief executives. So we have different avenues for that, and siguro isa pong magiging magandang effective way to reach them is yung policy briefs and yung pong ating magiging legislative forums and policy dialogues with them. So yun lang, sir.
Thank you very much, Ms. Yuli. For the sort of clustered questions for Dr. Harvy, well, there are some questions in terms of the approach, no, whether it should be top to bottom or bottom up, or a combination, no. That's one question, and then the question of how do you reach the decision maker, no? Because the decision maker seems to have a very, very, very critical, strategic, crucial role, no, in the decision making process. With that, actually, would be the context of the environment, no, that the regulatory or the environment for which the decision is made. So, how do you reach these decision makers, no, considering the access, no, and there was a related question on sometimes you need to be connected either politically or by family or by some means, no, to be able to reach these decision makers. So the next set of questions will be on the process of decision making. And here comes the issues of or the variables related to the social context, to the cultural context, to the political context, and the skills, no, that you need to be able to navigate through this really quite complicated setting, and to be able to uh, to make and to influence, no, certain decisions. And I think there were some questions that were saying, are there any proof? Are there any researches that has been done that has influenced policies along one direction or the other? So I hope it's not a bit. I try to compress it, Harvey, to be able to sort of give you the leeway to be able to articulate it in a more integrated way when you respond to this set of questions. Over to you, Harvey.
Thank you again. Thank you very much, Doc Dennis, for being our moderator and for um, uh, the set of questions. I think there are quite a number of people sending in their questions, and so it's also a challenge for you to screen through the questions and try to put them all together. So thank you very much. I will just try to address the questions one by one as you articulated them. So the question on the approach, whether it's top-down or bottoms-up, I think the question should not be whether it's either or. Okay, it's not a choice between the two. There are times when we have to do top-down. There are times when we have to do bottom-up. But the ideal really is to have a combination of both, because each approach will have its advantages and disadvantages. Maybe later Uli can elaborate, but I know for a fact, for instance, that the NURA, the recent NURA that we have, was primarily developed through a top-down approach. But the previous NURA was developed through a bottoms-up approach. So there are considerations on why we choose the one over the other. But just keep in mind that each will have its advantage and disadvantage. If we do bottoms up, then certainly we are hearing the people who are we are connecting to the people down there, and we are collecting their priorities and desires. On the other hand, there's also an advantage when you do it top down, because the top down at top level you have a broader horizon. You have a view of the national landscape, so you can also decide which one should be prioritized. So I would say it has to be a combination of both. How do we reach a decision maker? It can be difficult, especially if we are talking of political connections here. But maybe I will answer this by saying that it's probably better if we do this at the institutional level. Of course, we recognize that individually people have certain skills to network and to connect. But going back to what I spoke about in my first lecture on establishing partnerships, if institutions have partnerships at institutional levels, I hope it makes it easier for us to link researchers and policymakers with each other. Yes, the process of decision making is always contextual, and we have cultural considerations that have to be taken into account. That's the reason why in one of the slides in the last lecture, the study that I mentioned actually plays a domain for contextual. So we have to navigate that context also and be able to understand it. Okay, if we are to be effective in trying to translate the research into policy. And the last question on the proof on evidence that proof that the evidence was used for policy. The syntax law, for example, is proof. Dr. Tony Dance and the coalition that was behind the syntax was very active at that time, and they were able to convince our legislators that by increasing the tax for tobacco by this much, then we will be able to reduce morbidity by this much, etc. So that's one example. The work that we did for the emergency hiring of health workers for COVID. That's another example for where you see research being linked to the policy. I'm sure Doc Dennis can also share a lot of examples from IPC in this area. So quite a number of examples out there. Now that that was asked, maybe it would be nice to compile all of these examples and use them as case studies. I'm not sure if somebody has done that, but I'm saying it out there so that somebody will do it. And then they can be nice learning materials for people.
Thank you very much, Dr. Liwanag, Harvey. And with that, actually, that ends the Q&A part, no, for the second lecture of Dr. Harvey and the input from Ms. Ullyann Garcia. And we take note of the other questions that have been raised, and we'll review them as well, because we'll still have another session on Wednesday. And please don't leave, no. For our participants who are still with us, no, we're wrapping up in a few minutes, but please don't leave, because there are some instructions that we would like to give you with regards to the remaining days, no, of this workshop and webinar, no. So with that, I'll turn over the floor again, no, to Dr. Harvy Liwanag for the reminders and the announcements for the session on Wednesday and also on Friday. Over to you, Harvy.
Thank you again, Dr. Dennis. So this will be short now. So for our virtual workshop participants who are joining us right now, so I believe the team has granted you access to our Google Drive. So I invite you to please explore the contents of that drive. We have placed some of our handouts there. Just read them during your free time. And we have a document there explaining the small group discussion for tomorrow. So we will convene, particularly for the virtual workshop participants. I look forward to meeting you tomorrow. And the PCHRD team will be sending you the links for our interaction tomorrow morning. That's my instruction for our workshop participants. Do you have instructions for our webinar?
Yes, thank you very much, Dr. Harvy Liwanag and Ms. Ullyann Garcia, for the inputs and the responses to the questions that were raised this afternoon. Finally, I would like to make the announcement for the other or the webinar participants. Now, a post-webinar notification will be sent after each session. So today is the first session for this webinar. Webinar code for today is pinned at the chat box and will also be part of the post-webinar notification containing the link to the evaluation form. So our team will actually post the webinar code that you will use for the evaluation form. Kindly paste the webinar code, no, which is all capitals, no, PCHRD 1ST workshop _ day 1. So the code, as you will see on the chat box, is PCHRD all capital letters 1 ST, referring to the first workshop _ day 1. So please paste that in the evaluation form so that you can respond to the evaluation form and get your certificate. In this event, we would like to explain that there are two sets of attendees, as Dr. Liwanag explained. No? There are the workshop participants who will actually be going through this workshop the entire week, and we'll be making presentations on Friday, of which the webinar participants on Mondays and Wednesday are all invited. The general audience and the workshop participants who are given the workshop participants will be given readings and assignments. No? Regarding the certificates of attendance will be given only to individuals who will be able to attend the three webinar sessions, and upon submission of the accomplished evaluation form to be forwarded via email after the session. Certificates of participation will be given only to virtual workshop participants upon passing the quiz, which will be forwarded to them via email after the session on July 17. So, as mentioned by Dr. Liwanag, the workshop participants, all 31 of them, will have a separate session with him and with PCHRD tomorrow to be able to prepare for their policy briefs, which they will be presenting on Friday. So with that, we'd like to thank everyone who joined us this afternoon and hope you will make time again on Wednesday, same time, 2 p.m. to 5 p.m. for the second part of this first ever workshop webinar on research-informed policymaking in health. So, good afternoon, everyone. Magandang hapon po sa inyong lahat. Thank you very much to Dr. Liwanag. Thank you very much to Dr. Ms. Ullyann Garcia, and to our joint teams from the Ateneo de Manila University, Institute of Philippine Culture, and the Philippine Council for Health Research and Development of the Department of Science and Technology. Magandang hapon po sa inyong lahat, and have a good evening, everyone.